Full mouth reconstruction, just like the name itself states, is a dental help in restoring your full mouth. That could be an aesthetic case where a patient is a grinder, they ground down through half of their teeth, or a patient missing a great deal of teeth in their mouth, they want to replace those, and they have some of the teeth that are good and they just want to aesthetically touch them up. In that case, we probably need professional help in doing a full mouth reconstruction to open up your bite and giving you functional and aesthetic teeth. During the full mouth restoration cases, it's usually two-stage process, where first stage we give patient a temporary solution or temporary teeth at the new height, new look, so the patient can get to evaluate if their bite is good, if they feel confident and smiling, if their aesthetics is good. And at that point, any adjustment that needs to be done, we do. And then we finalize the whole reconstructive case with final zirconia or porcelain crowns based on what we find fit or what the patient prefers. Full mouth reconstruction cases give that wow effect, because they come in with broken down teeth, worn out, discolored teeth that hinders them from smiling. They no longer smile. Not even talking about the aspect of function. They come back and they smile. They say, "I love it, doc. This makes such a major change. My friends are noticing it. My coworkers. I feel good smiling in the mirror, and I smile nowadays." And as we know, smile is the best cure to any psychological or health-related problems. You smile more, you're happier. You create the proper hormones, and you just have quality of life automatically increased. And that all starts with smile. So we restore that smile. We give them patients ability to smile again. Be happy.